and welcome back to the drive home. Tanya, Kenna, Brian, and we have some guests in the house from HSHS St. Anthony's Memorial Hospital. We have Sherry and Karen, and we are going to be talking about speech language pathology today. Hello, ladies.
Hello.
Okay, let me make sure I've got you all turned up and ready. Okay. You're going to have to talk real loud in that one. Because
we got the weak microphone.
No. I think I can hear you.
Is it on?
Yeah. That's
Oh,
good.
I can totally hear you.
Yeah, you got the magic touch.
Yeah, okay.
Because we have great voice.
Yeah.
It matters, doesn't it?
It really does.
That's perfect.
I know. So
Good.
so we're going to talk speech pathology today, which maybe my words are just getting tangled today.
Yeah, we all do that.
Yeah?
So, some.
But I'm sure that that's not what we're talking about, right?
Well, it might be. Yeah, I don't know. Let's see what
We're
they say.
actually talking about voice disorders today.
Voice disorders, okay? You're going to have to explain that, what voice disorders are.
So a voice disorder would be an issue, something going on with the vocal cords, which are in your voice box. And so that is where your sound is generated from when you're talking. And so it could be a problem with the quality of your voice, possibly the loudness or even the pitch. So if any of those three things are interfering with your communication, that could be a possibility of needing some voice therapy.
Huh.
Now, what would you do? Like, what kind of voice therapy do you do for that?
So we basically would evaluate the patient, listen to their voice, talk about what their problems are. Maybe the voice is hoarse, rough, breathy. It might be a weak voice. And there's lots of issues that can come up with your voice for various reasons. But we would do a full-on evaluation of that, a one-on-one evaluation, and then set up an individualized therapy plan for the patient. And then we would do maybe some voice exercises, teach them how to use their voice, trying to get back the quality that maybe they have lost with their voice.
Or we may do voice relaxation. So if someone has a very tense voice and they're very tight and gravelly and hoarse, we may need to relax their voice.
So how do you do that?
Yeah, that's interesting. I've never
Do
thought
you
of that.
just say, like, back off?
Back off,
like,
Boogaloo.
We
whisper.
practice. No whispering.
No whispering?
No whispering?
Whispering's the worst thing you can do for your vocal cords.
Really? How does that work?
Okay, I did not know that.
So if you have
Yeah.
laryngitis, do not whisper.
Oh, my goodness.
Really?
You need vocal rest
Vocal
Just
and
like-
water.
and taking care of your voice.
Is vocal rest meaning total silence?
Yes.
Okay.
Possibly.
And not whispering.
Do not tell anybody around here in this building that I need vocal rest. They will tell you that I need to rest my voice.
It could come in handy sometimes. Yes, definitely.
Very interesting.
So I did not. Okay, I had no idea.
Yeah.
So, like, what are some of the techniques that you use if someone has a super weak voice? How do you get their voice a little bit stronger?
So there would be some different kinds of exercises we would do for that, namely exercises to try to get better closure of the vocal cords. So when you are turning your voice on and producing a sound, your vocal cords are vibrating. And they like to come together nice and straight and closed. And if anything's going on with the vocal cords, a lot of times that can't happen. So we do exercises to try to make the closure better and then make the quality of the voice better.
And when you say exercises, you're not like talking about jumping up and down doing jumping jacks. You're doing while speaking.
Yes.
Or
So
breathing.
we're actually doing a lot of exercises, kind of, some of them are like pushing exercises. So think if you push your hands together, I don't know if you can't visualize it, but push your hands together and hold your breath. What happens to your throat? Does it tighten?
It tightens. Yeah, it
Yes.
tightens up.
Yes.
A little bit, yeah.
So a lot of times when you push or pull, we are pushing those vocal cords together.
Okay.
So now if on the other side, if you have a tight voice or a tight muscle and we need to relax that we don't want those patients to be doing a lot of heavy lifting or pushing or pulling. Because
Okay.
every time you push or pull, you're straining your voice and your vocal cords.
Huh.
That's interesting.
I never knew that.
Enlightening And we use our voices all day here.
Right.
Right. So that is a lot of our clients would be folks that do a lot of vocal use in their jobs, already even at home. So it could be even school teachers,
Yep.
radio announcers, people that use their voice all the time. And sometimes it's just too much use of the voice, and it can cause issues. And so sometimes it can even cause things to occur on the vocal cords, such as vocal nodules, which Karen can attest to that.
Really?
I was a very loud child and did a lot of screaming. I had 3 older brothers, and I never missed a T-Town basketball or baseball game.
Right.
So,
I mean,
Yeah.
you know.
It
so
goes-
I did have bilateral nodules that were on my vocal cords, and they were touching. So if you can picture, vocal cords are supposed to be open. I had 2 large bumps.
And that's not good.
That's not good.
Okay.
Then the closure's not there. So then they throw off the closure of the vocal cords,
And you're harsh, hoarse, raspy, and
breathy
yeah.
sometimes.
Yeah.
So
Voice.
that's the reason, like when you're sick and you're not feeling well, and a lot of times when you have like a, I don't want to say like a,
Lump in your throat.
yeah, kind of raspy, like you said, like hoarse.
They're
You're-
irritated,
yeah,
red,
that's
inflamed.
that's the reason why.
Closure
And
issue.
sometimes that doesn't actually get better on its own. And so that if you have
Oh.
hoarseness for more than just a couple of weeks, it needs to be checked out by a
Okay.
physician.
Oh.
So a lot of times people will have laryngitis from
Right.
being sick, and they'll get better, but then a month later they get sick, then they'll get better, and then all of a sudden they'll get it maybe the 3rd or 4th time in the year, and they don't get over it. And then usually they'll go either see like an ear, nose, and throat doctor, who will then finally recommend speech therapy, and then we'll teach them some of those things, such as like vocal hygiene. Things that irritate our voice can be chemicals, if you're like around a lot of chemicals, if you're a house
yeah.
cleaner, if you're a heavy smoker, if you like foods with high acidity.
Caffeine.
Caffeine. Oh, caffeine is so bad for your vocal cords.
Really?
Yes.
Oh, no.
Really?
I see a 44-ounce drink over here.
It's 32.
32, sorry.
My coffee tumbler is hiding, by the way.
Wow.
But as
I
long
have
as you
lots
also
of-
drink water,
Well, that's got
Yeah.
water
Yes.
in it.
So
Oh
if you
my
drink your
goodness.
coffee or your soda,
Okay.
counteract that with a glass of water.
Okay.
All right.
Your voice is affected by your foods and drink.
I did
Yes.
not know that.
No
so,
clue.
so people with really severe reflux may also
yeah.
have poor vocal quality
Really?
because the reflux comes up and irritates the vocal cords.
So when you have a sore throat, I mean, they always say they, meaning, you know,
People.
my mother, or I mean, usually no. Well, I mean, because it's passed on generation to generation. I'm sure you guys have heard this from your moms. Gargle with salt water.
Great.
Is that what you're supposed to do?
Oh, that's a good thing.
Yes.
yeah. Okay.
Really? Okay.
That actually will clear out a lot of bacteria in your throat.
Really.
Warm.
Warm. Yeah, warm salt
Right.
water.
Actually, cold when you are sick, cold water is not really the best. That's singers drink room temperature
Okay.
water.
Huh.
So that's better for your voice, room temperature instead of cold.
Wow.
Cold will actually tighten up your vocal cords.
Ooh, and that would not be
Yeah, that could be tricky.
good. Okay.
Wow.
See, I'm learning so
Yeah.
much
So
right
I
now.
should
We
switch
need, like, the
to
manual.
hot tea, probably.
Well, green tea.
Decaf.
Decaf, I was just going to say. Now that we know.
I'm
Now-
mad.
So I guess another question would be, is what should you do if you suspect you may have a voice disorder? What do people need to do?
Yeah.
You can let your doctor know.
Mm-hmm.
They can then refer to us. You can give us a call, and then we can go through the process of getting an order from your physician.
Okay.
Sometimes you may need to see an ear, nose, and throat doctor before we actually would start any therapy. So
Okay.
an ear, nose, and throat doctor would actually visualize your vocal cords and see, are they irritated? Are they closing like they should? Is there a nodule or a polyp or something actually on them? Or is it just the effects of maybe some acid reflux going on? Do we need medication? So then at that point, you may come to us for some further help with how to use your voice and how to get your voice back.
Okay.
You mentioned visualizing your vocal cords. How do you do that?
They stick a thing down your nose.
They do?
Yes, they do.
I know, because I've had it done.
Really?
Oh.
Yeah, it's like a tube. It's got a little camera on it, and you have to open it and go, ah.
Oh, really?
And
Like
and they
say the alphabet?
well, you just go, ah. and then you'll go even more once they do it. But they stick a little thing.
That
in
could be
your
a pretty
nose,
good
and
show.
It goes down your throat, and,
Yes.
and it doesn't take long to do, but it's awkward,
Yes, they do numb your nose, but
Uh-huh.
yes, they do look down at the vocal cords. The only way to do that is to get something in there
Oh, yeah.
with a
Wow.
camera on it.
Next time
Okay.
you do that, can we come in and do a live remote? During
Really?
That? That would be
I
great
hope I
radio.
don't have to do it again for a while.
Oh.
It's been a long time.
Do it on him.
But I
would
did
you?
have to have speech therapy after I had it done because I had lost had problems.
Some function.
also back in the day. But I had
So-
a lot of ear, nose, and throat problems,
Yeah.
and that led to it.
Uh-huh.
Yes.
But really, in all seriousness, though, if people have a problem with their voice more than 2 weeks, that's when they really need to kind of reach out and to their physician and kind of get the ball rolling to get
Yes,
that
maybe
done.
just get it checked out
Okay.
for sure.
All right.
And one last question. You guys had mentioned those 3 areas at the very beginning, like quality, loudness, and pitch. What kind of things would be off on someone's pitch that you could correct?
So, like for instance, right now I have a patient who had a procedure and it made her left vocal cord more tight. So it has elevated. So now she talks really high all
Oh,
the time.
no
So when
kidding.
is anybody a singer in here? When you do scales,
No.
guess what happens? Your vocal cords tense and get tighter for a higher pitch.
Uh-huh.
So we have to teach her to find her normal voice instead of talking really high all the time.
Oh my
So,
gosh.
Yeah.
Interesting.
Is that hard to do?
Kind of recalibrate.
Yeah.
or-
bring that back down.
Exactly.
It can be.
It can be.
Oh my. Okay.
Yeah.
So
Pretty
everyone
cool.
has a habitual pitch where their voice actually talks the best at.
Mm-hmm.
So, yes,
Wow.
sometimes it takes a little bit to figure that out.
Mm-hmm.
Who knew?
I know. Yeah, this is like we need the manual that these guys have for us at the radio station here.
No, because I know the guys in the back. They'll just say she needs to rest her voice. She can't talk.
Give it
That's
a
what
rest.
that's what they'll do, and I know that. So
And that's hard to do when they tell you can't do. You're not to talk.
well,
Yeah.
And you're used to
right.
talking. That's
Yeah.
like a killer.
Mm.
Well, how can they get in touch with you guys?
So you can, we're located at the Workman Center,
Mm-hmm.
and our number is 217-347-1243. And you can call our front office, and you can ask to speak with one of us, or you can go ahead and schedule an appointment and go from there.
All right. Well, thank you, Sherry. Thank you, Karen.
Yeah, thanks, guys.
Thanks for
Thank you.
taking
Thank you.
a few minutes out of this gorgeous day that's outside. That's not going to be like this tomorrow at this
For
time.
sure.
But thank you for coming and chatting with us about voice disorders. I had no idea all
Yeah.
the stuff involved.
No kidding. Very pertinent.
Yes. Well, especially in the type of field that
That's
we're in.
right.
You got
I mean,
it.
it is.
For sure, yes.
I mean,
You
we
guys
gotta
could be
have
at
a
higher
voice.
risk for having some of those issues.
Yeah.
For sure.
Yep.
Well, thank you guys so much. We
Thank
really
you.
appreciate
Thank you.
it. We
Thank
really
you.
appreciate
Thank you.
it. We
Thank